About acute inflammation part 3. It's very easy and very simple topic, by the way. I don't know why people think it's difficult to understand, but it's not. Vapshe not. Very easy. Okay, what are the two mechanisms of phagocytosis? Okay, we need two mechanisms. First is a very secure, a very fast, a very efficient way. Second is a very inefficient way. Efficient means it has O2 in it, it has no O2. It is dependent on O2, not dependent on O2, because O2 gives us more ATP, and if we have more ATP, have more energy, and it's like good pathway. So oxygen dependent pathway and oxygen independent pathway, two pathways. Oxygen dependent is more efficient. It means it kills more bacteria. Explain the O2 dependent mechanism of phagocytosis. Well, phagocytosis happens in phagolysosomes. You do know phagolysosomes? Phago plus lyso gives us phagolysosomes. Okay, so phagocytosomes, again, oxygen is converted. Okay, cool stuff coming right away. Very cool stuff. What happens is that O converts to superoxide via NADPH oxidase. Okay, this reaction is called oxidative burst. We need that. If we are deficient in this enzyme called NADPH, we will not convert oxygen into superoxide. Okay, so we need that. Once the superoxide is converted to hydrogen peroxide. Okay, it's very important. Hydrogen peroxide is really great at removing a lot of things, right? So hydrogen peroxide is done, the converting is done via superoxide dismutase. Now, if you guys remember, superoxide dismutase is one of the way to remove this free radicals. Okay, let's revise this, by the way, because it's best to revise this right away. I hope you remember this. It was in free radical injury. In free radical injury, we know that oxygen with the help of oxygen, when it receives one electron, becomes superoxide. Again, it receives one electron, becomes hydrogen peroxide. Receives another one, becomes hydroxide. OH, the most dangerous one, receives another electron, becomes water. Now, in this phagocytosis, what happens is that the water steps is missed, right? Instead of becoming water, the hydroxide group, it becomes something else. I'll tell you what it becomes. What happens is that this is the ions, right? This is physiological, because this happens because this is how the phagocytosis happen. We need free radicals to phagolyze to destroy the bacteria, right? Okay, so I was telling you about this NADPH oxidase, right? And it converts O2 into superoxide, right? And I told you this enzyme called superoxide dismutase. It gets rid of superoxide, okay? And another thing, hydrogen peroxide can be get rid of catalase. We need to have catalase to get rid of hydrogen peroxide. We need to have glutathione peroxidase to get rid of hydroxide free radical, OH. To get rid of OH, we need this glutathione. To get rid of H2O2, we need catalase, and to get rid of superoxide, we need dismutase. But to convert that, which thing? To convert what? Let's see. Part 3. That is it. To convert superoxide into hydrogen peroxide, we need superoxide dismutase. Okay, if you have problem in this superoxide dismutase, what will happen that you'll not make hydrogen peroxide, which is very important to make bleach. Your body can produce bleach, which is HOCl, right? And HOCl is made with hydrogen peroxide converted to bleach via myeloperoxide, so MPO. So we need these three enzymes: NADPH, superoxide dismutase, and myeloperoxides, right? And this bleach can kills the organism. This is the main oxygen dependent pathway of phagocytosis, right? Okay, what's the mechanism of chronic granulomatous disease? Okay, what is chronic granulomatous disease? Let's see. Due to defect in NADPH oxidase. So there is defect here in the first step. If there is defect on the first step, oxygen won't be converted into superoxide. If there is no if the superoxide is not getting made, what will happen that the bleach will not be made, right? Because the first step is messed up. So NADPH is messed up. What will happen? This oxygen dependent phagocytosis will not happen. There will be a chronic granulomas. We'll talk about what are these granulomas. This is nothing hard, nothing intelligent, very easy. What happened is that this disease is autosomal recessive. It means you have to have both, biallelic messed up genes, right? And it's X-linked. It means that it's carried by woman. How it's carried? Okay, let's talk. You have 46 chromosomes, 22 are autosomes, and one pair is. So 22 pairs are autosomes and one pair is sex chromosome. So, okay, women make XX, male have XY, right? Now you get one from female, one from male. You can get Y or you can get X, right? But from female, you will 100% get X. So what happens is that if it's X-linked, it means it only stays in the X part, right? So there's only 50% chance that a man carries it, right? And there is 100% chance that, right, if she has both messed up, it's recessive, right? It's a recessive. You have to have both messed up, right? So, for example, a man gives you this one messed up gene, right? He gives you this X really bad, this mutated X gene, right? And the woman gives you a good healthy one. So you will not have the disease, okay? But imagine if a woman is carrying it and she has one messed up, right? And she has one good. She has one messed up and one good. What will happen? That she carrying it, she doesn't know it. She is carrying it, but she is healthy because only one is messed up, and you have to have both messed up because it's a recessive. It's not a dominant, disease. So it's a recessive. So X, she gives you bad gene. Male gives you a good one, right? Maybe X, he gives you, or maybe a Y, right? So usually what happens is that it's X-linked, it's a gene on X. So male gives you 1X, female gives you 2X. So she is usually a carrier, right? I hope you understand. I'm really bad at explaining genetics right now. I think I can explain you much better, but I don't want to drive into this, because it's a pathology. We're trying to understand pathology, not genetics. It's not really different. Pathology and genetics are not really different. We'll talk about it. As a patient can't do phagocytosis, more and more macrophage and neutrophil are called to the site, right? And they result in the formation of granuloma. What is granuloma? Granuloma is just big macrophages plus some neutrophil collected together. They become like a granuloma. That's it. Okay. What are 5 catalase positive? Catalase positive. So there are catalase positive bacteria and there are catalase negative bacteria. So catalase bacteria that cause symptomatic CGD. What is CGD? Chronic granulomatous disease, right? So Staph aureus, P. cepacia, often tested. This is very important. P. cepacia, S. mercescens, nocardia, aspergillus. These are 5 positive catalase bacteria, right? Not bacteria, organisms. Okay. Let's see. Why do only catalase positive produce CGD? It's a cool point. Why is it cool? Because most bacteria produce something called as H2O2. H2O2, which is hydroxide. Oxygen hydroxide. What was it? This hydrogen peroxide. I keep forgetting the names. I'm so sorry. What happens is that most bacteria produce H2O2. Okay, they make it themselves, right? Which can be converted to bleach by ML, right? Myeloperoxide in the body. Okay. Therefore, most bacteria can't cause CGD despite mutation in NADPH. So even if you have this, NADPH mutation, you will, let's read it. When the bacteria have something called as catalase, it destroys your H2O2, okay? And the formation of the bleach is reduced. And it results in CGD, okay? So catalase is this enzyme that stops what? That stops this hydrogen peroxides from working. Okay, it stops this by what? By, okay, how in the body in bacteria can't use CGD despite of so it destroys this. So basically the whole concept I'm saying is that bacteria has produced H2O2, right? And they have catalase as well, right? And then this catalase is responsible for destroying H2O2, which later converts into bleach. So this bleach, we cannot form this bleach, right? Because bacteria have catalase, and this catalase stops us from making bleach. So no phagocytosis, right? I hope you understand this thing. It's not very complex, okay? It's very easy to understand. What is tetrazolium test? If a screening test for CGD, in the test, it's a test of screening, okay? Solution turns blue if superoxide radical is present, right? So superoxide is radical is present, it means your superoxide D. What is D? Superoxide. Wait. Superoxide dismutate is working. Okay. So if you have superoxide working, if your NADPH is working nicely, it means the solution will turn blue. Okay. So nitro blue test for NADPH, right? Solution turns blue if superoxide radical is present. It tests if NADPH is functional or not. Okay, simple. What's the clinical significance of NBT? This nitro blue tetrazolium test for people with myeloperoxidase deficiency. Now, if you have myeloperoxide deficiency, what will happen there? Most MPO patients have asymptomatic because they lack the last enzyme that converts the thing, this hydrogen peroxide into bleach. They lack this MPO. Once they lack this, they are asymptomatic, but they have more risk of candida because candida is a opportunistic fungal infection. What happens is that they have normal NBT test. Okay, this is normal because they have NADPH normal, right? Because they can convert oxygen into superoxide, right? They can convert it oxygen into superoxide. They have this, okay, but this part, the myelo part, where hydrogen peroxide converts into bleach, this is messed up. So if this is messed up, what will happen is that they will have, candida because it's opportunistic. They think they're all right, but they will have, reoccurring candida infection. Explain the oxygen independent, the other pathway. What happens is that it's a less effective pathway, occurs via enzyme in a cool shit coming. Secondary granules, okay? What are secondary granules? These secondary granules are specific granules, okay? They are present at myelocyte stage of hemolysis. Not hemolysis, what I'm saying. These are secondary granules, okay? Okay, if I'm saying there is secondary granules, it means there are some primary granules as well. What are primary granules? Primary granules are the granules that are produced in the early stage. They are pro-myelocytic stage, right? They are pro-myelocyte. They will make myelocytes. These are specific granules. Describe the resolution phase of, resolution means getting normal, right? Phase of acute inflammation. So within 24 hours of resolution inflammatory stimulus, the neutrophil dies, right, by apoptosis. It creates something called as pus. Pus is nothing but dead neutrophil. So if you guys have some problem with, adhesion, do you remember this disease where this adhesion was not working? Do you remember this? I remember this disease. It's called LAD, leukocyte adhesion deficiency, in which the leukotrienes cannot get stick to the wall, right? There is some problem. What is the problem? There is some problem with this adhesion, right? If they cannot adhere, it means they will not go to the cell. If they cannot go to the cell, the pus will not be formed. So here in this thing, the pus is not formed, and this secondary is done by, okay, oxygen independent phagocytosis is done by secondary granules, right? And this resolution phase means after 24 hours, within 24 hours, the neutrophils die and the pus is formed. And if the pus is not formed, the addition is not working, and this is the reason why pus is formed, because pus is a pus is a result of resolution. Okay, describe the macrophage phase of acute inflammation. We know that macrophage phase is the third phase, right? We know that first phase, fluid phase, second is neutrophil phase, peak, and third is the macrophage. It's 2 to 3 days, right? So it peaks after 2 to 3 days after inflammation begins. When the monocyte, I told you, monocyte go into the tissue. Then after, when they are in the tissue, we call them macrophages. Okay, these macrophages, they come into the tissue in the same steps as neutrophil. So the same 5 steps of inflammation is happening. What are the 5 steps? Migration, rolling, adhesion, transmigration, and phagocytosis. Okay, these are very simple. Migration is just from the center they go to periphery. Rolling is that with the help of selectin, integrins, and cam, and something called as Louis X, they get stopped. Adhesion, we know adhesion. Transmigration is just they jump the vessel wall. Chemotaxis, and then from the extracellular space they go to the cell, we call it chemotaxis, and then the phagocytosis happen via O2 dependent and via O2 independent pathway. O2 dependent, we know it's from bleach, and O2 independent is from secondary granules. Okay, I hope we get that. Simply understand, I hope we understand it, right? Okay, contrast phagocytosis of macrophages with that of neutrophils. It's cool question. How? Phagocyto killing of macrophage is mainly oxygen independent. Okay, so macrophage kill via secondary granules. Okay, via secondary granules. Lysosome is the main enzyme. Okay, lysosome is also present in neutrophil, but neutrophil usually kill the bacteria with the help of bleach. Phagocytotic killing of neutrophil is mainly oxygen dependent, means O2 with the help of NADPH turns into superoxide, and then this superoxide turns to bleach. You know how, right? Okay, what happens after the fluid neutrophil macrophage phase is done? What happens after that? Okay, now it's a cool story. What happens in the end is that macrophage, they come to the site of inflammation again to check. They are the manager to check within 2 to 3 days, right? This phase, 2 to 3 days. They go there and they check the condition. What happens that if the neutrophil, they did a good job, what happens that they will secrete something called as interleukin 10 and TGF beta. Now TGF beta is the opposite of TGF gamma. Gamma is pro-inflammatory, beta is anti-inflammatory. The IL-10 and TGF beta, they are anti-inflammatory. They induce healing. Okay, they stop healing. What is healing? Healing is just when you're with the, so healing can be of 2 types. Again, it can be with the help of, if you have stem cells, if you don't have stem cell. If you have stem cells, new cells will be formed there. Cells will be just replaced. If you don't have stem cells, if these are permanent cells, what will happen is that the scars will be formed, the fibrin will be collected there. So let's talk about it later. Healing. If the job is done poorly, what will happen? That macrophage will again start to induce inflammation. IL-8. Do you remember IL-8? With IL-8, we have something called as interleukin beta. No, let's go Srazu to this 4 list because it's very important. It's a cool way to keep remembering. It's a cool way to revise. IL-8, C5a, and LTB4. Okay, leukotriene B4, C5a, the complement part, IL-8, and bacterial product. They are neutrophils lover. Okay, all 4 of them. Okay. If the job is done poorly, macrophage secrete IL-8. It causes the addition neutrophil of the site to the site. If the macrophage senses that offending organism needs to walled off, it creates something called as abscess. Now this abscess is a walled off area of inflammation. If the macrophage senses that neutrophils can't do the job well, the X neutrophil don't work well in viral injury. Example, not X. Neutrophil, okay. What will happen is that macrophage will start chronic inflammation, and this chronic inflammation is T cell mediated. Okay, and then this chronic inflammation, the antigen is presented via MHC2, and that we know MHC2 is done to what? CD8 or CD4? CD4, because 2 into 4 is 8 and 1 into 8 is also 8. So this is CD4, this is CD8. It's a very shit logic to remember, but it always works. So chronic inflammation is done after the acute inflammation, and this is done via macrophage. Okay, so macrophage is the messenger for acute to transform into chronic inflammation. This is the whole story of acute inflammation. Very simply, it's a very simple. We need these NADPH, superoxide dismutase, and myeloperoxide to make bleach. This is oxygen dependent pathway. Oxygen independent pathway is done via secondary granules. Pus, what is pus? Dead neutrophils with fluid is pus. And what else? TGF-10 and TGF-beta are anti-inflammatory. So this was the whole acute inflammation in very short.